Well, good afternoon. I'm here in a little bit of a reunion with the former Public Health Director of the City of Detroit, Dr. Jonae Caldoun, who's now much more prominent as a state figure on TV, but we got her to come back. And also joining us is State Representative Stephanie Young, who used to be here and a big part of our program, who's now up in Lansing. But I want to talk to the community about something that we haven't been talking about nearly enough, and it's going to be really important, and that is the health of our babies. From the time I came in, I was extremely focused on reducing the infant mortality rate in this city. It has been extraordinarily high for a long time. I dealt with it every day for 9 years, running Hutzel Hospital. And every year at Hutzel Hospital, we would deliver 500 babies a year that were 2 pounds or less. Babies you could literally hold in the palm of your hands. We know these premature births are preventable by good prenatal care. And so Dr. Caldoun just released the statewide infant mortality rate numbers for 2019, the last full year we have available. And what they show is that it dropped very slightly, about 28 fewer deaths. And it's difficult to talk about infant mortality, but the definition is a baby who does not make it to their first year of life. And so there were 28 fewer. The interesting thing is all of the reduction came from the city of Detroit, because this is Detroit's infant mortality rate. And it's the number of babies per 1,000 that we lose in their first year. And it has hovered between 15 and 16 for probably 20 years. And last year, in a remarkable reduction, we dropped to 11 per 1,000. That is the lowest number of infant deaths in this city as far back as we have records. A third drop from the year before. And I'm going to talk to you about the people who made it possible. And then we got to talk about what we have to do to make this continue in the future, because with COVID, we are seeing all of the good programs and all the good efforts of pregnant moms that led to this reduction. We're starting to see them slip away as people are not making their doctor's appointments, not just in the OB-GYN, but as Dr. Caldoun will tell you, in pretty much every specialty. I want to say thank you, because this is the product of a whole community. There's a lot of people who've been in the trenches for years. Wayne State University's Make Your Date program gets a lot more attention because of its relationship to me than the fact that it's saving babies' lives, but Wayne State has been terrific. The City of Detroit Sister Friends program, which was started by Dr. Abdul El Sayed. I thought it was a visionary move and was really built into its current form by Dr. Caldoun when she was there. Henry Ford Hospital and Kimberly Dawn Wisdom have been running the WIN network for years, reaching out in this community. I worked with her 15 years ago at DMC. And the St. John Providence Infant Mortality Program has also been a great program on the east side. This is how we do it. It is everybody participating together. We've got the doula and midwifery programs, the Black Mothers Breastfeeding Association has a lot to do with making that first year of life healthy. The March of Dimes, which has supported all of these organizations, and our Regional Infant Mortality Reduction Task Force, and the Southeastern Michigan Perinatal Quality Improvement Coalition, and Vern Anthony. Back in, I guess I can't go back that far, but back in the 1980s when I was in Wayne County, Vern Anthony put me on my first infant mortality prevention program. She's been a leader in this issue for 20 years and is a huge part of why we have dropped so significantly. But I'm going to say this. I don't think anybody is more responsible for the 2019 results than Jonae Caldoun. And I'm going to show you why I say that. She probably won't want the credit, but I believe it's true. Within the numbers I just showed you, one of the most heartbreaking aspects of the city of Detroit is that black babies die in their first year of life twice as often as white babies. And what this chart shows you is the infant mortality rate. This green line is for white babies in Detroit, the yellow line for black babies in Detroit, and that's the way it looked in 2018. But it's been running about twice as often, and there are a whole lot of reasons for that. And in 2017, Dr. Khaldun came to me, and she said, I've had enough. I've got a complete program, and I want you to back everything I want to do. And if you've met her, you realize that you end up doing what she says. And in this case, it turned out to be visionary. And here's what she showed me, that one of the biggest gaps would seem pretty basic, but 25% of all pregnant African American women who don't make it in to see the doctor in their first trimester, which is so critical, said the main reason was a lack of transportation. In fact, black women more than twice as often said the lack of transportation is keeping me from the doctor. And what Dr. Khaldun said is, there is no reason we cannot solve this transportation problem. This is a huge part of the black-white healthcare disparity. It's getting a ride. It isn't the doctor. She said, I want to fix it. And so here's what she did in August of 2017. She said, we're going to take our programs and put them together, but I'm not just going to offer a taxi service. I'm going to couple our biggest support programs with a ride. And so she went and took Make Your Date, which was doing a great job at Wayne State with medical advice and getting the parents to bring the baby to full term, and Sister Friends, which was doing a great job with providing emotional support, having somebody you could call that you might not want to bother the doctor for. She said, I'm going to put them together, but she said, here's what I know. No program works if you can't get to it. And the big change we're going to make is we're going to make Sister Friends and Make Your Date work together, which was not a small accomplishment by itself. But she said, we are going to provide free lift rides for every mom in these programs. They're going to be able to dial up the 961 baby at Sister Friends or the Make Your Date number. And if you got to get to your class, your education classes on maternal health, or if you got to get to the doctor's office, Lyft is going to come get you and take you. You know what they were doing before that? And this is what Dr. Khaldun showed me. You know what these programs were doing? And many of the other programs. They were giving DDOT bus passes to pregnant moms. Now, if you happen to live on a DDOT line and your doctor happens to live at the other end of it, that's fine. But of course, in this city, you're waiting for a transfer, you're standing outside, you may have to walk several blocks. And what Dr. Khaldun said to me is, we're going to scrap this plan of pregnant moms getting DDOT bus passes, and we're going to give them door-to-door service from their home to their doctor. And she said, I need $500,000 a year. Now, in the city budget, a $500,000 appropriation when you haven't spent it before, as tight as our budgets are, that's a major commitment. She made the case, Detroit City Council backed it, and we started the program in late 2017. And that first year, we had about 700 rides. By the second year, it was over 5,000, and by 2019, it was over 6,000. We made enormous strides in eliminating the racial disparity in access to doctors because of transportation. And Dr. Khaldun, I can remember her like it was yesterday, sat in my office in 2017. She said, if you'll fund this $500,000 a year on these rides, I think we can start to change the racial disparity by 2019. City Council, to their credit, deserves that. And let me show you this year's number. We've had a chance now for a full year of these rides. And this past year, as you can see, the white infant mortality rate was 10 per thousand. The black infant mortality rate was 12 per thousand. We haven't gotten parity, but we have dramatically reduced this. You cannot change the racial disparity in healthcare in this country without being very conscious, without being very intentional, and that was the leadership that Dr. Khaldun provided. Now, I can't tell you for certain that transportation was the driving factor, because as I said before, there are a lot of folks who are working at this. The folks at Henry Ford, the folks at St. John's, in these groups, they've been working for a long time. But I'll tell you the biggest single factor in 2019 that was not there before was the 6,000 rides that the pregnant moms can get. And so I'm sure Dr. Khaldun will do studies on this, but I suspect when we find out, we'll find out transportation was in fact the biggest piece. Here's why we're talking today. We know what we did work. Pairing the support programs with the rides changes the number of babies. And this is hard to talk about without being emotional. But this is real. We have to confront this. So in 2015, we had in this city 9 white infants and 125 black infants did not make their first birthday. Every single one was a tragedy. And then each year you saw numbers that were pretty much the same. The number of black infants was running, even on a population basis, double the rate of the white infants. Look what happened in 2019. What did we change? It wasn't the infant mortality rate among the white infants, but you saw, if I do my math correctly, 55 more babies were alive at the end of the year. 55 of our precious children. This is what happens when you have a public health department and you have a strategy. We can change the racial disparity in health care. But my concern is, like so much else with COVID, we're starting to slip back. And so since last March, what have we seen? Fewer moms have enrolled in Sister Friends. Fewer moms have enrolled in Make Your Date. Fewer moms are taking their Lyft rides. And I've talked to OB-GYNs across the city and across the state. And because of the fear of COVID, we've got moms who are not making their prenatal appointments. All of the progress that we made in 2019, we have the potential to let slip away. And so what we're here today to say is the resources are here, the support's here, you got great medical care in this city, and the rides are there. And we're going to ask you today, and I'm going to show you in a minute how to access them. But I called Dr. Khaldun, and she's very humble. What you saw in 2019 is a major reduction in the infant mortality rate in Detroit that wasn't seen in the rest of the state. If you give her some time, she'll drive the rate down for the entire state of Michigan. But I do believe it was her vision in 2017 that got us moving in the right direction. And with that, I'll turn it over to our former director, Dr. Joné Khaldun.
Thank you. Oops. Thank you, Mr. Mayor. It certainly is quite humbling and exciting to be back here today to talk about something very, very positive and something that I'm quite proud of, and certainly not for me, but just all of the work and all of the great partners across the state, in the city health department. Really just so many people have done such great work. You know, in 2019, as a state, we saw the lowest infant mortality rate ever recorded, as the mayor mentioned, 6.4 deaths per 1,000 live births. That's the lowest rate that the state has seen in over 100 years, since we've been tracking this actual number. And what the mayor also went over is that it's important to see that what we saw in the disparity ratio was a significant decrease. So 3.2 to 2.6 when it comes to the difference between black and white infant deaths. And as he mentioned, a lot of that came from what happened right here in the city. So the city's infant mortality rate in 2018 was 16.7 infant deaths per 1,000 births. And in 2019, as he mentioned, it went down to 11. And this is really just so important, and he's right, it is hard to get emotional. I'm an ER doctor. I have pronounced infants dead before. And so what we are talking about today, these are not just trends, this is not just data, these are people's lives, these are people's children. And it's just really, really just such important work that I've truly been an honor to be a part of. But again, I also want to emphasize that so much of this is about partnerships and people who have been working in this space for decades, really, who have put in place the infrastructure, the strategies, the programs that I think when we start diving into the data a little more, we'll be able to see how all of those came together to really make this work. So I have to talk about the Regional Perinatal Quality Collaboratives, the Michigan Maternal Mortality Surveillance Committee, My AIM, the Michigan Alliance for Innovation in Maternal Health, the Fetal Infant Mortality Review Teams. Again, these teams literally go through the data for every infant death, and it's tragic. It's really difficult, but we look at that and we identify strategies and things that went wrong and things we can improve. Of course, the WIN Network, Make Your Date, the Black Mothers Breastfeeding Association, there's just so many more and a lot of work that's been done, and I'd like to thank all of those leaders. And what it really shows me, quite frankly, and what I like to say is Detroit is resilient. Detroit and the state of Michigan is resilient. We have the people, the knowledge, the resources to be able to get this type of work done. And all it really takes is for there to be a strategy and for us to bring it all together. And that's what we've done. And I think that's why we've seen this in the data. So I also want to, again, so fond of my time at the Detroit Health Department, and I would also be remiss if I didn't name Leslie Welch, who was also the deputy director at the Detroit Health Department under Abdul El Sayed and myself in the beginning of my tenure, and she really championed Sister Friends as well. So Sister Friends was a very simple concept, providing mentorship and social supports for women who are pregnant. And it wasn't just that, but it was really about social supports and can we make sure that we're giving you transportation, again, so important, transportation to your prenatal appointments, free birthing classes, breastfeeding classes, connections to evidence-based home visiting programs, which are really, really important. We even spent time trying to connect women to housing if that's something that they needed. And some of the mothers really did. They would deliver their babies and then have nowhere to go after they deliver. Can you imagine that? But our team worked so hard, was so committed, and actually connected women to housing. And so, while I think this is certainly a time to pause and acknowledge the efforts of many, I hesitate to say this is a time to celebrate because as the mayor went through the data, we still have too many babies that are not making it to their first birthday. And we still have disparity. There should be zero disparity, no difference in the rates of infant mortality between white babies and black babies. And that is our goal as a state, and that's what we have to continue to strive towards. So I'll also say this is a priority for the state under the governor, Gretchen Whitmer, who's really just been out front with this. The governor's Healthy Moms, Healthy Babies plan actually puts forward really bold actions to address not only infant mortality, but maternal mortality and the racial disparities that exist there. So an African-American woman is actually 3 times as likely to die from a pregnancy-related condition as a white woman, not just in Michigan, but across the entire state. So the governor's plan actually looks at creating 1,000 new slots for home visiting programs for at-risk families, increasing access to both medical care and behavioral health care for women postpartum, but also expanding Medicaid beyond 60 days postpartum, which is really not enough, expanding that to 12 months, a whole year after a woman delivers, which is really, really important. So I'm overall very, very optimistic, and it's just so exciting. It's a homecoming to be back here today. We've got a lot of work to do, but I'm very just proud of all of the partnerships. Saying Representative Young, congratulations. I don't think I've been able to say that to you yet, but congratulations on your election. It was wonderful working with you, and I know you'll share your story about your support of the Sister Friends program as well.
So thank you, Dr. Khaldun. We aren't here to celebrate 2019's numbers, although we're proud of them. We're here to get pregnant moms to get the proper care in 2021. And the Lyft service, the free transportation, is available to you. You just pick a program, and you can be on that program. You call, they book the Lyft ride for you, and the Lyft ride comes to your house. So you have 2 choices today, and both of them have the way in. So first is Make Your Date, which is focused on carry your baby to your full term for your 9 months. The babies are healthier for life, and you can call 313-577-1000 or makeyourdate.org. It is a very powerful experience that I've had for a mom to come up to me and say, I lost 2 babies through miscarriage. and I joined Make Your Date. They gave me the kind of medical and testing and support so that I took the baby to full term. And when that mom brings the baby to one of our events, it's a very powerful thing. And the other is the Sister Friends program that's run by the Detroit Health Department. And basically what Sister Friends is, as Dr. Caldoun described, we need moms in this town who want to be mentors. A lot of times it's a 15, a 16, a 17-year-old, or it can be an older person who's having their first pregnancy, who needs somebody they can get on the phone with once a week and have somebody you can talk to. But if you call today, 961-BABY, and enroll in Sister Friends, we will get you into the lift rides even before we match you with a partner. We can take care of you right now, and the folks at the Detroit Health Department are waiting for you. If we are going to engage this again, though, I'm going to again reach out to the moms in this community. We need those who have had babies, who've got some maturity, who've got the wisdom, to sign up to be Sister Friends. And basically what that means is at least once a week, you're going to be on the phone with the pregnant mom, providing the kind of support, counseling, and in many times just in ear. And at this point, I'm going to have somebody join me in that pitch to ask the women of Detroit to sign up. When Dr. El Sayed and Dr. Caldoun started Sister Friends, one of the very first persons who volunteered was a person who was a district manager working at our administration. And I didn't even know it till I went to a meeting. I said, "What are you doing here?" And she said, "I was one of the first volunteer Sister Friends." She's now better known as State Representative Stephanie Young. But I want her to talk about her experience being a Sister Friend and to ask for help from this community to sign up. So, Representative?
All right. Thank you so much, Mr. Mayor. Thank you for listening to the visionaries, listening to Dr. El Sayed and listening to Dr. J, and knowing that this was the right direction to go in to help our moms and to make certain that our little Black babies get a chance. And so to that, I want to just say thank you. And I'm glad to be here on today. My time with the Sister Friends program was just amazing. I was able to be matched with a young lady, and like the mayor said, there are differences. My little sister, she happened to have been married. And you think about that, well, she's married, she's got some support at home, but what we also found was when I got to know her, she had been raised in the foster care system, and she didn't really have family, and she didn't know what to expect with her first pregnancy. And so that's when the Sister Friend program showed up, and I was so glad to meet her. I was so glad to form relationship with her. We would have conversations on a weekly basis about anything that she would want to talk about. And during our conversations once, we talked about the fact that she had a doctor, but she really, you know, as they say, she wasn't really feeling her OBGYN. And I said, "Sweetheart, you do know you can change doctors." And so worked with her along that process until she was able to get a physician that she, you know, was able to connect with. You want to be connected with the person that's going to bring new life into your family. And so things like that. And then she had her first baby. And the way the program works is you journey with the mom throughout the pregnancy, and then for that whole first year of the pregnancy. And so I had an opportunity to journey with her through the pregnancy. She had her very first son, and that was amazing. And during that next year, his first year of life, while we continued to stay in touch, she got pregnant again. And guess what? That allowed me a chance to reset. So now I got a chance to get an extra year to be a Sister Friend. So now our conversations about having siblings and how we look out for them as a mom. I'm a mom of 2 boys, and she ended up having 2 boys. And so this is what I would share with those thinking about becoming a Sister Friend. Know that the time commitment isn't something to be concerned about, because when you form relationship, you're actually adding to your family. We're like family. And so it's nothing for me to pick the phone up and call her, like it's nothing for her to pick the phone up and call me. Our relationship started back in 2017, and now she has 3 babies, all of whom know me as Auntie Stephanie. So I am encouraging you to take the time, carve out just a few minutes out of your day and get to connect with these moms. They need it. We cannot assume that moms know what's happening. And for a mom to not know that she couldn't get a doctor, a new doctor, that is something as simple as that made the difference in her life. And so I'm just encouraging you all to step up, join us. I'm looking forward to getting another little sister. I'm not done. I've still got a lot to add, and I can't wait to, I get that chance to do that once again. So and let me just share this, one last little testimony. So the LIFT program is amazing. And even if you have transportation, there comes a time when your transportation might go out. They are able to help in situations like that. And so I'm so excited about these numbers, knowing that transportation is making all the difference. So when we partner the transportation and we partner the moms with mentors and we're there journeying with them throughout their pregnancy in that first year, I just can expect the numbers to only increase. So with that, I'll turn it back over to Mr. Mayor, and thank you for allowing me to be a part of this today.
So we are going to have a second subject to talk about on Proposal N, but before we do, I want to allow Dr. Khaldun and Representative Young to finish up. So at this point, we'll take questions related to the prenatal care programs, and then we'll go on to our other subjects. So does anybody have any questions for Representative Young or Dr. Khaldun?
Hi, good afternoon. I'm from Fox 2. Just curious, what words of encouragement are you offering young women or women, period, who are pregnant to set aside the fear and not let that prevent them from making their appointments so that these numbers don't drop even more?
Yeah, I'll take that. You know, it's certainly been concerning to see over the past now 15 months our rates of people just coming in for regular preventative care, which was not shut down, seeing people not come in because they were scared. I'll tell you that our healthcare systems are safe. Much of the healthcare staff actually are vaccinated themselves. They have protocols. We didn't have protocols in the very beginning, back in March. We've got very important safety protocols in place. It is so important for you to make your prenatal appointments, to make sure that you're connecting, taking your prenatal vitamins and doing all the things that you need to. There's also other programs, home visiting programs that I talked about. So I just would encourage mothers to not put this off. It's very important to make all of your appointments so that you can have a healthy baby and also take care of yourself.
And you had to talk about the recommendation you have relative to COVID vaccines in pregnant women.
Absolutely, important point. So we're in the middle of a pandemic. Absolutely. The CDC has said that the vaccine, there is no reason for any pregnant woman to be concerned about these vaccines. That these vaccines are safe, they're effective, and we are asking every pregnant woman to talk to their doctor about when they can get the vaccine. Absolutely.
Any other questions?
No, that's
Right.
it for now.
All right. Thank you, Representative. You can go
Yep.
back to doing the people's work. And
Yeah,
Dr.
and you're
Khaldun?
calling me. I gotta go vote.
Right.
God bless everybody. Thank you.
We have more good news today. I think it was almost exactly 1 year ago that I stood in this room with several members of Detroit City Council and laid out to the people of Detroit the commitment of Proposal N, both to save the houses that can be saved and to demolish the houses that can't be saved. And I made a commitment at that time that when we move the demolition program from the land bank over to the city, with Boise Jackson, the procurement department, and Lawan Counts as the demolition director, that we would get more than 50% of all the work being done by Detroit companies. We, a couple months ago, put through the first demolition contracts. They were 100% Detroit companies. And today, we're doing the first rounds of securing the houses for rehab. And so what we are doing is going through the houses that can be saved, and there's several thousand of them, but we want to make sure they're preserved, which means we go in and clean them out. We put secure view, that very heavy plastic windows over the doors and the windows, and we fix the roofs. This is the first round of the contracts to secure it, and I am glad to report that we are sending to City Council 23 bid packages awarded to 6 winning bidders. 5 of the winners are black-owned Detroit companies, so we're not at 51%, we're 5 out of 6. The 6th winner is with us here today, a joint venture between GTJ, which is a St. Clair Shores company, and MWV Environmental, a black Detroit company. And this is the way we envision this working. You're going to get a chance to hear from the leaders, but MWV, which is an asbestos company, wants to branch out into a new area. And so Boise Jackson came up with this concept of a mentor partnership, that companies can start out mentoring with a more experienced company, and then in the future will be bidding on their own. And I was really pleased to see the first mentor winner here. And so here's what's going to happen. Assuming council approves these, we've got 276 vacant houses that are going to be secured. We're not going to have squatters going inside. Nobody's going to be lighting fires. Nobody's going to be dealing drugs out of them. The rain won't be coming in. We will have them fully secured. And the contractors who are being awarded today will start by cleaning out the trash and debris from each of the homes. It's the first step in the process to securing these very structurally sound houses for the long term. Once these contractors come through, Lawan Council's team of city workers will come through, put the clear view on the outside, and secure the doors and windows so nobody can get in. And at that point, we will feel very good about the future, so that as people buy the houses and rehab them, they know they can go in and put a furnace in. And because you've got the security, you don't have to worry about somebody stealing it the next day. This is going to add value to every one of these houses. We're going to secure several thousand, but this is our first step today. And we're a little nervous till we see how the bids come in, because we really wanted to see Detroit companies succeed, and we're really pleased with the results. And with that, I'm going to turn it over to Boise Jackson, who does an outstanding job as our procurement director, to talk about the winning bidders today, who they are, and how this works.
Thank you, Mayor. Good afternoon to everyone today. I'm very excited today to talk today about the proposed winners that we have as a part of this proposing and program. We got a lot of response in this program. We got responses from existing companies throughout the city and abroad, as well as small companies. I'm happy today, however, to share with you a lot of the small companies won the bids in this particular area. Guyana Corporation won 96 of the 276 properties. J. Keith Construction, 72. And we'll come back later and introduce some of the members of the new mentor venture that the mayor talked about, a company called JTJ and MWV. Last year, they started talking about some of the opportunities in the city collectively, and that partnership is really, really something we really look forward to. P&P Group, Detroit Grounds Crew, and Motor City Preservation. So altogether, 276 properties, approximately $700,000 in this. And if you recall before, when Lawan and I and the mayor were here on the first group of demolition properties, it was around $30 million. So we're real happy that these companies have came forth. If you look back at the list, I want to talk about the percent of Detroiters. And this is an opportunity and a time to share with you the commitment that these companies are making and they're hiring Detroiters. 78% of these employees will be Detroit residents. Guyana, 75%, J. Keith Construction, 76%, Mentor Venture, 72%, 100% out of P&P Group, Detroit Grounds Crew is 62%, and Motor City at 80%. So if you look at it, we're hiring, and these companies are investing over 60 jobs will be going to Detroit residents, about 80 plus employees totally in this first group of properties. I want to take a moment, however, and tell you about ongoing cadence that we have in place beyond this. So this is trash outs. We first brought to you the demolition properties, but this is not the stop. This is not the stop or the end of this. We have released B on demolition that is due on April 14th, that was due on April 14th, that we'll be sending to City Council on next week as well. We, on April 28th, have our third release of demo properties going out, and we are hoping that they'll be back on May the 12th with no problem. and then we got our fourth release, a demo. So what am I saying? We have an ongoing cadence of these demolition and trash out properties that are going out for many different companies to continue our efforts in wanting to see Detroit companies and other mentor and joint venture companies get business in their work. Our second release of trash out, since that's what we're talking about today, will be going out here pretty soon. It'll be another 300 properties that'll be going out. So ongoing cadence of demo properties, ongoing cadence regularly for trash out properties. And we hope, again, that many other companies, like even in this case, we have two new companies that haven't done a lot of work with the city before, P&P and Motor City Preservation. However, they step forward and say, hey, we want an opportunity to participate in this great program. So they got their stuff together and came forward, and we're confident that they'll be doing good things for us in the future. So at this time, I'd like to turn it over to LaJuan Counts, who is our Demolition Department Director. LaJuan?
Thank you, Boise. So the demolition department is very eager to get started with the trash out work. We were very intentional in our outreach. We engaged with Boise staff with the Office of Contracted and Procurement, and we actively began to outreach to contractors and vendors with the intention of making sure that we did have a significant amount of Detroit-based business participation. So we're very pleased with the results of this package, of this group of releases, but we definitely are very pleased with the joint venture mentorship program and that work that produced GTJ and MWV's partnership. And so we'd like to introduce them. That's Blake Johnson and Katrina Williams.
Okay, well, good afternoon. It's a pleasure being here today. I'd like to thank everyone at the city for this opportunity. We're very much so, Katrina and I met about a year ago, right in that area, at a pre-bid conference. We've been in this business for quite some time, and she reached out to me after the conference and said maybe there's an opportunity for us to work together. So we reached out to the city and let us know that there was an opportunity through the Mentor Venture program where we could work together and we could help Katrina diversify her business and grow within this framework that we've been doing this business for 20 years. So far, we've been able to help out, transfer a lot of knowledge, and we look forward to getting work on this contract and hopefully working on many other as we move forward. So we're just thrilled about this opportunity, and once again would like to thank the entire city of Detroit for this opportunity.
Good afternoon. My name is Katrina Williams. It's a pleasure being here today. I thank Mr. Mayor for the opportunity. I thank Boise Jackson and the procurement department for coming up with this ideal to create a mentor venture, and LaWanda Counts for assisting in the demolition program. MWV has been in the business for 5 years. We specialize in abatement. And oftentimes we come across houses that's full of debris. So what other way could we think about expanding our horizon was to look at the trash out program. So like Mr. Blake stated that we met over a year ago. We formed a relationship and we discussed about how can we both get involved in some of the new opportunities the city was presenting. And we couldn't think of anything better than trash out and securing and boarding up houses. So it's a great pleasure to be a part of it, to work with the city of Detroit and work with JTW, and we just look forward to all the opportunities and being a part of the city of Detroit revitalization.
Well, this is the way we envision it, and I can't wait to see the future. So, Blake, how are you going to deal with it a year from now? When Katrina is successful at her own, it beats you at a bid.
That's okay. There's plenty of work for everybody involved, and we've had a long history of working with subcontractors and helping them, frankly, grow their businesses, Mr. Mayor. Katrina has a soft spot in my heart. They're very hardworking. They've been very successful with the asbestos work. They're very interested in doing this, and so we're going to show them the tricks of the trade, and then down the road we might be competitors, but we'll certainly be friendly competitors.
Yes.
Well, you think about the amount of work, there's going to be $250 million of work over the next 3 or 4 years. And we need lots of good companies, because we would like to go faster. Lawan would like nothing more than to be doing 500 a month instead of 300 a month. And Boise would like to be speeding up the demolition process as well. So this is the idea, is we grow more and more companies that have that expertise, and we're going to respond by moving even faster to rebuild our neighborhoods. And this is what we wanted. Detroiters working for Detroit companies, removing the blight from Detroit neighborhoods. And with that, we'll take any questions.
Mayor, we just have a couple of questions. First, after the trash outs are done, what's the process and the timeline look for doing the roof repairs and putting the clear view up on the homes to get them fully secured?
Lawan?
So in some cases, the clear board might happen prior to the trash outs, but the intention is once the property is cleared out, our crews will come in and install the clear board. The roof work will be determined on an as-needed basis, so not every property will receive roof work, but we'll do those assessments during that time as well.
Okay, and for Mr. Jackson, is the Mentor Venture program unique to this bid package, or is that something that the city's doing in other areas as well?
The Mentor Venture Program, as well as the Joint Venture Program, is not unique to any particular program. We want to continue pushing these type of relationships throughout our contracting process. These type of construction, demolition-related projects, as well as other services throughout the city. In our upcoming outreaches that we'll be continually doing throughout the city, Lawan and I and the other directors in the city will be continually urging people to partner together, to gain some experience, as well as seek out other companies that can help them continue doing goods and services, providing goods and doing services throughout the city. So we will continue this effort going forward in other areas.
Okay, so if a company wants to join up with another one, what's the process? What's their first step?
Good question, John. For those companies that are interested and wanting to do that, we would ask them to contact two organizations, the Civil Rights, Inclusion, and Opportunity Area, as well as the Office of Contract and Procurement. And for numbers today, if you could just dial 313-224-4603, and we can start the process using that number. But as well, you can go on the Civil Rights, Inclusion, and Opportunity website, or on the Office of Contract and Procurement website, then you can navigate your way there.
So Blake and Katrina, how hard was it for you to go through the process of bidding as a mentor partnership?
Well, for MWV, it was pretty easy. Blake and his staff were wonderful to work with. He kind of like guided us through the process, and we gave them our input on what, how we do things in the abatement industry. So it worked out really well.
And so did you get a certification from CREO? How does that work?
Yes, we applied for a certification through CREO.
And you get certified as a mentorship partnership, which gives you an advantage on the bid, which is what we're looking for. So I'm glad to see that it worked so well. I know our bureaucracy is always that smooth, but this is what we're trying to do, is one contract at a time, creating more opportunities in this community.
Okay, and as last question.
All right, thank you very much.